everybody. Welcome back to Friday Facts. I'm Dr. Alice Barsoumian, Chief of Infectious Diseases at BAMC.
Hi, and I'm Dr. Elizabeth Markelz. I'm also an infectious disease physician here at Barsoumian Medical Center.
And today we wanted to talk to you about respiratory illnesses, specifically influenza and COVID, kind of bringing it back to how we started all of this Friday Facts series.
Yeah, so it's back to school, right? Actually, my kids have had back to school night this week, and certainly with the back to school activities, I certainly in my household and my friends' households have noticed increasing respiratory symptoms in our kids. So the runny noses and the coughs and sore throats are back.
Yep, my son last week was too ill to go to school on his birthday. So we kept him home, and he had only been back to school, I think, for 2.5 weeks or something like that time. We tested him for COVID, and he was negative. So that was useful, but we managed him at home until he felt better. He still kind of has that lingering cough. You know how kids get, and feeling kind of sorry for himself with how annoying it has been.
Yeah, so it does provide an opportunity to think about what can we do, right? I mean, certainly it's back to how can we keep others from getting sick? How can we keep ourselves from getting sick? So certainly when your kids are sick, keeping them home is great to prevent other kids from getting sick. And that applies to us as well. So if we're sick, we should stay home. And then to prevent sickness, certainly that hand washing, so that's something that we're always going to talk about, the benefit of washing our hands.
Yeah, so washing your hands is the top thing you can do. It's one of the layers of protection we have. I think not even having the transmission is best. It was a really difficult decision. My son was not fevering. And it was really inconvenient for us to keep him home from school, but ultimately it is better. They called about him at school that day, which was unusual. I don't know why, because usually I just get the automated call, and I told the counselor that he was sick, and she says, "Oh, well, maybe it was allergies." No, it's not allergies. We know what happens when kids go back to school. They get colds and they pass them along. Unfortunately, one of my son's friends came down with an illness very similar to Michael's, and did have fevers and stuff. So not every kid's going to have a fever. So don't use fever as the metric on when to stay home for you or your child. If you think it might be allergies, it also might be a respiratory viral illness.
In addition to hand washing, and certainly for those at highest risk, you know, if you're going to be in crowded areas, you also may want to bring back your mask, bring out your mask again. But I think this is a good opportunity to also talk about vaccines, because we do have some vaccines available as we head into the fall and winter seasons.
So that's right. So available in the community and not yet at Barsoumian Medical Center is this year's seasonal influenza vaccine. The seasonal influenza vaccine is a recommendation we have for all of our patients. The CDC recommends that we administer it to patients prior to October 31st, so prior to Halloween. And I know that it is available with some of our civilian partners right now, and that is an option if you want to get your flu shot. We don't have a due date or an expected arrival date of the influenza vaccine at Barsoumian Medical Center, and when we do, we are going to make sure we provide those updates to the community through social media and other notifications.
Yes, absolutely. And another exciting vaccine that we have available for the first time this year is the RSV vaccine for our adult patients who are 60 years and older, and especially those who have additional health concerns. Their asthma, they have obstructive pulmonary disease, they have an impaired immune system, chronic kidney disease, diabetes, heart disease. So basically a lot of things that most of our older patients do suffer from. They now have a vaccine that's one dose. There are 2 vaccines that have been approved for RSV, which is often thought of an infection that affects kids and children, but we have seen a fair amount of pneumonias or lower respiratory disease in older adults. I'm really excited about this vaccine.
Me too. I think it'll also impact the community numbers we see. At least that's my hope. I've certainly seen my fair share of RSV pneumonia And the prevention is way better than the treatment for all of these viral illnesses. The RSV vaccine is available at civilian pharmacies. My parents are not beneficiaries, but they were able to get theirs at a civilian pharmacy recently once that became available. It's going through the approval process here at BAMC, and so we will also let you know when that is available, and hopefully we can get it to you guys all this season. So we've got some great docs and pharmacists working on expediting that approval process.
Yes, so we'll definitely keep you informed. And just for all vaccines, I think it's really important, especially these vaccines for respiratory viruses. Our goal really isn't to prevent you from getting infected with that flu vaccine or that RSV vaccine or the COVID booster. It really is to keep you from having severe disease. So we want to keep you out of the hospital and at home with your family this fall and winter.
Yeah, so a cold is better than pneumonia, and an asymptomatic infection is better than a cold for sure. So you mentioned the COVID booster.
Yes, so we've had already multiple COVID boosters with multiple variants, and now we're in the process of having the newest one evaluated and approved. So hopefully I hear that perhaps it may be available at large in the next week or so. I don't know when we will have it here at Brook Army Medical Center, but again, as soon as we get it, we will let you know.
Yes, so I'll be excited to see how that shapes up as well. People ask me what they should do to treat these illnesses. So we do have some antivirals and antiviral strategies for influenza and for COVID. And if you're diagnosed with either of those, contact your PCM to see if you would be eligible or benefit from treatment. And I just say, I have really been loving talking to my PCM on MHS Genesis Patient Connect. I mean, they may not like it, but it's been pretty easy to get a response without being impatient on the telephone.
Same. I have found it very helpful. So I think the biggest challenge is probably logging on.
Yes.
So once you overcome that challenge, it's a great method to review your records and to communicate with your provider. So please take advantage of that.
Now, if you're not eligible for an antiviral, so prevention is better than treatment for these viruses, and there's not good treatments for all patients or situations. People do ask me all the time, what should they do to make themselves feel better? Should they take ibuprofen? Should they take acetaminophen? So those would be things like Motrin or Tylenol or others, cough drops and vitamin C and echinacea and all that. And really, I like to tell my patients to target the symptoms that bother them the most. Just so you don't have to take every single medication, you can relieve the symptom that's most bothersome. So your daytime symptom that's most bothersome might be different than your nighttime symptom that's most bothersome.
Yeah, that's great advice. And again, with any illness, infection, just make sure you stay hydrated and get rest.
Definitely. So my son, I mentioned, he had his recent illness. He's sucking cough drops down like they're candy. So we probably have to divert from that strategy because it's possible that he just wants to suck on cough drops.
Oh, yes. What flavor cough drop?
I got a multi-pack with a citrus flavor, so it has 3 different citruses in it. I opted for the name brand, which is so unlike me, but he's my youngest, so I guess I was a softie. Okay. All right, well, those are the updates that we have. And so, just highlights, personal hygiene, staying home from work or school if you're sick, getting yourself tested, in consideration of, wearing masks and getting the vaccines when they're available to you or on the economy are the ways that we conceptualize flu season and staying healthy during this respiratory illness season.
And just one more plug, there are tests available in many of the primary care clinics for home testing. So that's the antigen test. So if you feel like you need some home tests and you've run out, reach out to your primary care clinic and see if they have any for you to take home.
Well, I guess that's all that we have. I'm looking forward to the weekend, of course. That's the great thing about Friday Facts is that we get to see you towards the end of the week. So hopefully everyone has a nice weekend as well.
Yes, have a great weekend.
Bye, guys.